Aid agencies inside Somalia have in recent days faced stiff challenges due to violent attacks by insurgents targeting their operations and staff. The heavy fighting between Somali government troops and armed militia groups has left the country in a desperate situation, as most international aid agencies have suspended food distribution, among other humanitarian activities, because of the danger posed by the current instability in the war-torn country. The SOS Mother and Child Hospital was set up 2 decades ago to cater for the health needs of women and children free of charge, as most of the Somali residents could not afford to pay for medical care. Patients have been known to travel up to 400 kilometers to receive treatment at the hospital.
Dadka imaanayo waa dad runtii real mataqaan emergency ma aha dad normal ma imaanaya dad waxay imaanayaan dhowr dhakhtar u tagay dhowr meel kale u tagay oo leeyahay anaga wax ma ku sameyn karo oo macna sabab badan ama ha ahaato mataqaan qofkan maaragtay inuu yahay maaragtay qof aan lacag iska bixin karin ama inuu ahaado qof maaragtay la soo silciyay mataqaan oo dhakhaatiir badan loo geeyo oo leeyahay mataqaan anaga wax kuma sameyn karo iska tag.
The main SOS Children's Hospital has remained closed since October 2011 due to insecurity. For now, 200 women and 450 children attend this temporary facility daily, where SOS medical staff cope as best they can.
Dad badan oo nooga dhinteen had ugu dambaysan nin baa nooga dhinto shaqaaleena soo shaqadii ku jira ayaa madfac soo dhacay madficina maaragtay si xun ayuu kala gooyay maaragtay shaqada maaragtay jirkiisi waxayna noqotay in xataa meeshii laga qaadi waayay uu isbedelay 6 maalmood isoo yaal nala ogolaaday in meeshii aan ka qaadno oo la aaso meedkiisa.
Amidst the heightened insecurity, mothers like Daka Musa still make their way to the hospital. She has traveled for days, desperate to find a cure for her son who suffers a wasting condition.
waxa hayo 2 sano iyo 5 bilood u jira ma fariisan karo qorta ma celin karo saas meesha u dhigtay inaad adigu ka dhaqdhaqaajiso maaha kama u dhaqaaqi karo.
Prior to the relocation, SOS Hospital catered for over 130,000 women and children and delivered about 5,000 babies every year. But due to increased fighting in the region, SOS has had to function as an emergency hospital, treating not only victims of famine, but victims of war. Restricted humanitarian space is a concern to the European Commission, one of the largest donors of humanitarian aid in Somalia.
If more and more agencies are being restricted or banned or cannot implement, we will have less capacity to implement programs in South Central Somalia. In 2011, we have come up with some quite innovative ways of delivering aid, but it's clearly not an easy environment, as the example with the SOS hospital that suddenly became on the front line. It's very difficult to predict war and exactly where the warring fractions or parties may move or may not move or may stop. And suddenly we had a hospital right on the front line.
Today, the greatest casualties of Mogadishu's front line are women and children, who can only hope for a better future.